Hello everyone. This is a very brief technical demonstration of our B.Tech Final Year project assessment of knee osteoarthritis using thermography done by Subiksha, Deepika and Virender Pal Singh under the guidance of Mrs. P. Manikavalini, Assistant Professor of SRM University. We are B.Tech Final Year Biomedical Engineering students of SRM University. It has been estimated that about 15% of the population in India is affected with osteoarthritis, and X-ray is being used as a standard technique for diagnosing osteoarthritis. Since X-ray is a radiographic technique which may lead to harmful effects in future and it is not affordable by everyone, this imposes a need for an alternating diagnostic technique which is thermal imaging. Thermal imaging is a cost-effective, easy and radiation-free method for diagnosing osteoarthritis. So, what is osteoarthritis? Osteoarthritis is a disease involving wear and tear of joints. It leads to discomfort and disability during walking and movement. The main risk factors of osteoarthritis include age, especially older people, and gender, female gender, and heredity, obesity, and occupation, which involves more workload and physical movement. The main aim of our project is to analyze the temperature in knee osteoarthritic patients in comparison with the normal participants using thermographic technique. The objective is to measure the temperature distribution in knee for osteoarthritic patient using thermal imaging camera and to segment the image using k-means clustering algorithm and Roberts edge detection algorithm. An FLIR-A305SE thermal camera was used to thermal image the knee of osteoarthritic patients, and it was kept at a distance of 76.2 cm from the patient. The temperature of the room was controlled at 23 degrees Celsius, and the patients with metal implants were not included in the study. The setup of the thermal camera can be seen in the figure. Black background is used to eliminate the external environmental infrared radiation. An informed consent was obtained from the participants and their details were collected. The metal ornaments of the participants were removed. The knee X-ray of the knee osteoarthritic patients were obtained for validating the presence of osteoarthritis, and the severity of the osteoarthritis is graded from the X-ray using the Kellgren-Lawrence grading scale by the doctor. A questionnaire was used to evaluate the physical disability of the osteoarthritic patients, which was referenced from arthritis impact measurement scales to 14 knee osteoarthritic patients were included in the study and their age group were categorized as shown. The severity of knee osteoarthritis can be graded into 4 based on Kellgren-Lawrence grading scale from the X-ray. Grade 0, that is KL0, shows no radiographic features of osteoarthritis, refers to a normal person. KL1 will show possible joint space narrowing and osteophyte formation in the X-ray, which symbolizes the starting stage of osteoarthritis. KL2 shows definite osteophyte formation with possible joint space narrowing. KL3 and 4 are advanced stages of osteoarthritis, which shows multiple osteophytes, definite joint space narrowing, and possible bony deformity. The thermal images was taken in anterior-posterior view in 2 positions, sitting and standing. The change in temperature will be depicted as change in color in a thermal image. The sample thermal images acquired can be seen here. The temperature difference between the knee osteoarthritic participant and a normal participant can be seen in the image shown. An arthritis score is evaluated based on the questionnaires related to knee activity. If the score is less than 30, they are said to have poor knee activity, and if the score is between 30 to 54, they have fair knee activity. If the score is between 55 to 79, they have good knee activity, and if the score is greater than 80, they are said to have excellent knee activity. The thermal images obtained are processed in MATLAB software and segmented using K-means segmentation algorithm and Roberts edge detection algorithm, and their outputs were compared. The flowchart of the K-means clustering algorithm can be seen here. Initially, the thermal image of the osteoarthritic patient is obtained and it is converted into HSV. The K-means clustering groups similar pixels together, and the iteration will continue until the cluster groups data points based on features. Finally, the output will be obtained. The Roberts edge detection algorithm is the simplest edge detection algorithm. The thermal image of the osteoarthritic patient is obtained and the edge operator is applied to get the output image. Both the k-means clustering algorithm output and the Roberts edge detection algorithm output of the osteoarthritic patient's thermal images can be seen here. The regions where there are abrupt changes in temperature in the thermal images are segmented and shown distinctly in the output images. The k-means clustering algorithm output and the Roberts edge detection algorithm output of the normal participants is shown. There is no segmentation since there is no abrupt changes in temperature in the participants. The osteoarthritic participant showed higher skin surface temperature than the normal. The maximum skin surface temperature of osteoarthritic participants ranged between 32 degrees Celsius to 36.3 degrees Celsius, while the normal 31.3 to 34.7 degrees Celsius. The minimum skin surface temperature of osteoarthritic participants were in the range 27.3 to 32.3 degrees Celsius and a normal 26 to 31.8 degrees Celsius. The mean skin surface temperature ranges of osteoarthritic patients were 30 to 30.7 and in normal 29.2 to 33.4 degrees Celsius. This is a bar chart showing the comparison of maximum skin surface temperature of knee osteoarthritic patients and normal subjects, from which it can be inferred that the temperature of osteoarthritic patients is higher than the normal subjects. A confusion matrix table was used to evaluate the performance of k-means clustering algorithm, from which we were able to obtain an accuracy of 0.785 and a misclassification rate of 0.214, true positive rate of 0.785, false positive rate of 0.214, specificity of 0.785, precision of 0.785, and prevalence of 0.5. While evaluating the performance of Roberts' edge detection algorithm using the confusion matrix, we obtained an accuracy of 0.892, misclassification rate of 0.107, true positive rate of 0.866, false positive rate of 0.076, specificity of 0.923, precision of 0.866, and a prevalence of 0.535. While comparing the performances of k-means clustering algorithm and Roberts edge detection algorithm, Roberts edge detection algorithm provided us better results with an accuracy of 89%, which is higher than k-means clustering algorithm of accuracy 78%. Roberts edge detection algorithm showed a less misclassification rate than k-means output. Thus, we conclude that there is a significant difference in skin temperature between knee osteoarthritic patients and normal subjects. The segmented images indicate the variation in temperature in the osteoarthritic subjects. The Roberts edge detection algorithm gives better output and accuracy than K-means segmentation algorithm. The advantages of the study are there is a significant temperature difference between osteoarthritic and normal subjects. The segmented part of the image indicates the region of variation in temperature. Thermography is a non-invasive, non-contact, non-destructive, and radiation-free technique for diagnosis. Its reproducibility and sensitivity makes it useful for carrying out process. It is a cost-effective technique that would be beneficial to all people in the community. It is a simple method for diagnosing osteoarthritis. Finally, we would like to thank our head of the department, Dr. Mario Michael Anbarajan, and our project guide, Mrs. P. Malika Velani, for their guidance throughout the project. We would also like to extend our gratitude towards Dr. N.S. Rajarajan, MS Ortho, for guiding us in the hospital camp. Thank you.